This conference will now be recorded.
Welcome to Dr. TSPR show. This is Dr. Tangella Shiva Prasad Reddy alias Dr. TSPR. Namaste, Adab, hello. Let us introduce the guest. Let me introduce the guest first. Dr. Amitav Banerjee, Professor and Head Community Medicine and Clinical Epidemiologist, Dr. D.Y. Patil, Medical College, Pune. Welcome to this special show once again, sir.
Thank you, Dr. Reddy. It's a pleasure.
Yeah, I want your voice to go up. And the topic today is interesting. Last time, this will be in consonance because of his rich, vast experience, which will be very, very, very helpful for a common citizen to understand what the pandemic is, that is Corona, and how to deal with it. And are we dealing as it should be? Because health is wealth. What is happening in India and abroad? Is it that fear which should rule us, or the knowledge of this pandemic when it comes to our own natural immunity? This we call Sahaj Rog Nirodhaka Shakti. Sahaja Roga Nirodhaka Shakti. Is that is important, which you get it through walking in the sun, eating nutritious diet, spending happier times with your family or friends, and by also exposing to those affected, or else you yourself might have affected, got recovered, because test, trace, test and quarantine 14 days. Why they were doing quarantine for 14 days? Were you hospitalized? They themselves were shouting, don't need of hospitalization. 99.9% you can recover on your own. Simple tablets, Ayurvedic, homeopathic, like Kerala and other states, they have recovered. What did they do? They have allowed your own Sahaj Roga Nirodhaka Shakti, natural immunity, to come to your rescue. When such is the case, what is happening now? Mass vaccination, that too under trial vaccines which doesn't go through liability or compensation angle, where there is no data. You are scaring people to get into mass vaccination in spite of Pathanamthitta, Kerala, 7,000 cases. They very clearly stated, this official department itself, immuno escape in spite of Covishield and Covaxin. We have done shows. I wrote mail to Indian Council of Medical Research, to Honorable Prime Minister, to Honorable Chief Justice of Supreme Court, to all concerns, including DCGI, Drug Control Government of India, all respective chief ministers, chief secretaries. When it is not working, why there should not be any alternative in the form of Anandaya Corona or other Khadar Millet, Khadar Wali's millet therapy or natural therapy? So many things were there. Why not? And top of that, what about the natural immunity? That is why today we have taken this topic as elephant is nothing but your own Sahaja Nirodhak Shakti. Elephant is kept in a room, but outside you are making people to get into fear psychosis in the name of pandemic through lockdowns, vaccinations, under trial, even drugs also. When you are hospitalized, losing lakhs of rupees, many people died. Is it because of drug trials? That is also big fundamental question which these officials, including the rulers, should answer. So yes, sir, welcome to this special show. And
thank you, Dr. Reddy. Thank you.
Yes, I'll make you presenter. Before that, if you want to make some comments.
I may not agree with you. I'll give my own views. I may have some interface which are common, and I would like to give the data which will, again, as I said last time also, I cannot give opinion. I only put questions through the data. So I will be presenting some data and we will go through the questions.
Yes, sir, you are the presenter now, please.
Okay, let me share the screen. Where is my desktop? I will share the screen, and as I said last time also, I will be presenting the data, and we will be just discussing the questions from the data without any opinion, because we don't want to unnecessarily get into controversy. I will just, can you see the screen? No.
No, sir. I think it has gone back.
Share. So now I press this, which one? The green, you know, the green one.
Yeah.
No,
Yeah,
there
down
is
you
a,
have.
this is the screen. Who is
This
talking?
is share screen, sir. This is the down button.
This button on the right?
Down button. That one you share screen.
I have sent share screen. People can see a screen. You can see the screen?
It is GoToMeeting screen which has come on the screen, sir.
People can see your screen. It is saying people can see your screen. So
Next slide, you have introduced your GoToMeeting screen.
Middle screen.
Instead, you share the screen, sir.
People can see your screen. Can you say options? Make presenter, remote control. Make presenter.
No, sir. You come back. I'll tell you. You are using Mac, right?
Yeah. So I have got
because you have opened GoToMeeting screen, sir.
GoToMeeting.
What I'm trying to tell you, when I made you a presenter, you go down and just click screen, share screen. So that's why you come out of this first. You come out of this first.
There's some advertisements actually.
Yes. Now I am able to see you screen. Right.
Just a minute.
DPU, Dr. D.Y. Patil Vidyapith, Pune. Is it in the mail?
It's not in the mail. It is, I have put it on the desktop. This is, can you see it now?
References are there now.
Now let me
go up, sir. Up. First slide you go. Your last slide is seen. Now you go to the first. Yes, like that. That's good. Yes, sir.
Now we have view. It is coming. Where? How do I play? Where is the play? Play. So yeah, I got it now.
Yes, sir.
Yeah. Now you can see. Now you can see the screen.
Yes.
So this is the actual discussion today. Is the elephant in the room. Elephant in the room in English, it's a phrase which means there is a big thing in the room and nobody at the size of an elephant, and everybody is ignoring that. So what I want to stress is that there are a lot of elephants in the room as far as a country is concerned, and Asian countries are concerned. And then the question of mass vaccination. Definitely everybody wants to end the pandemic, but we'll just see from the data whether mass vaccination is the answer. So this is the elephant in the room. Are we deliberately overlooking some unique factors which is having an effect on the COVID pandemic in our country? Factors such as, we will go subsequently to the data, younger age of the population, low level of overweight compared to the West, and cross immunity with other coronavirus due to crowded living conditions and high population density. We will compare the population densities of all countries with Western countries also, because the measures we are blindly copying from the West, whether with this population density, whether we are achieving what in interrupting the transmission, or we are increasing the transmission. Then higher levels of natural immunity, like what has happened in the past 18 months is all right, but as on today, we should review the situation. And as per the survey in month of June by ICMR itself, 67% of our population had antibodies, IgG antibodies at that point of time in June. 67%, and it is known that antibody level decrease over time. That means it maybe you can add another 10-15%, almost 80% of a population might have encountered the coronavirus. This is from the data, it can be inferred. This is hard data. And now there are studies from Israel that person who has encountered and recovered from natural infection is 13 times more protected than the vaccine from infection, and 26 times or 27 times more protected from severe disease compared to the vaccine. and vaccination coverage at the time of the sero survey was less than 5% in our country when the sero survey was done. So majority of the infection, or 90 crores or 85 crores of people got it before the vaccine rollout. So this is an important timeline, and immunity from natural infection, as I said, is 13 to 27 times more robust than vaccine-induced immunity. These are the recent studies from Israel. There are studies from Cleveland Clinic. We have also done a similar type of study, of course, on a smaller scale in our Pune. And we found the reinfection after natural infection is less than 1%, and that too also self-limiting. So these are now more than 11, 12 studies which shows that recovery from natural infection leads to very solid immunity, more than the vaccine immunity. So these are some of the things which we want to discuss. That this is one of the biggest elephant, is that high, almost 80, 70, 80% natural immunity Indian population have acquired. If you want to, if ICMR and other bodies can confirm it by other repeated sero surveys, we can, because this was in June, now we are in September. And of course, the herd immunity is natural immunity plus vaccine immunity. We are not discounting the vaccine immunity, but we should not discount the herd immunity also, because the consensus is that herd immunity or natural immunity is being discounted or ignored. In fact, if 80% or 70% of our population are having natural immunity, you are vaccinating them blindly, duplicating nature's efforts. Nature has given them immunity by infection. They have recovered. Unfortunately, some have died, but those who have recovered, they should be recognized to have had some immunity. Some of the European countries are recognizing it. But when we have got such high immunity, we should be recognizing it. Then there are other measures, like on the other side of the seesaw are the lockdown, mask, hand hygiene, social distancing. How much impact it has got? Because anytime the cases increase, again we go for the same measures which has not worked. Had they had worked, we would not have had a 70% or 60, 70, 80% people getting infected, as the sero survey by ICMR, their own sero survey is showing that. Because the purpose of mask, the purpose of social distancing and hand hygiene and lockdowns were to prevent the infection. But in spite of the best efforts, very stringent efforts, we have not been able to prevent it, because we will see it is not because somebody to be blamed, because of our different conditions compared to the West. Now we will see what is epidemiology. Basically, epidemiology is how the disease or communicable disease or other diseases act out in a population. We have to consider three dimensions. One is the environment, other is the agent, and third is the host. Three things are there. Like anything, even in a cricket, if the fast bowler is there, on some pitches bowler is fast, other pitches bowler is slow. Similarly, the coronavirus, in some pitches it has had a major impact, and other pitches it has less impact. So we should be like a good cricket captain. We should know how to, the strategy should depend on the environment, the agent factors, and the host factors. Each country, these three factors are entirely different. So one method in one country, if you do it in the other country, it may have just the opposite outcome. So let us see the environmental factors first. Europe, first is the population density. Europe population density is 34, USA is 94 per square kilometer. India, it is 464. You see how many times more, almost four times more. And Bangladesh is still higher population density. Just people are together, they are living together, they are working together. So, and there have been research also that the transmission dynamics naturally depends on population densities. It is not rocket science. And Western countries can separate people by physical distancing, lockdown. In our country, what happened? Lockdown, people were pulled inside of the road. Nobody can walk on the road. They had to go into the very crowded living conditions. Perhaps their living conditions were more crowded than their working conditions. On one hand, you have finished their occupation. People are hawkers, people are working outside. They might have been less exposed to infection. They are pushed into the crowded slums, tenements. Even middle class houses are very crowded compared to Western houses. So whatever you try to achieve by lockdown and these measures, you have just increased the transmission, and which is reflected in our sero survey results. Hypothetically, people in high density countries may have another advantage is that because of the crowding, we are exposed to so many infections. Like this is a novel coronavirus, but there are other 3 or 4 other coronaviruses which are circulating, and the studies in Singapore and Sweden have found that people not exposed to the novel coronavirus also have cross immunity from T cells and memory cells. So probably people in our congested conditions already have, unlike the Europeans who are more vulnerable to any new novel variant of coronavirus. So we may be having that. We require more research, indigenous research, rather than copying the research of the West. So we require more scientists who have got self-confidence, who are self-assured to do research in Indian conditions. Then other thing is, like again, as I said, Delta variant started in India only in October. Delta variant was circulating in India, and the second wave was a very massive wave, which was by the Delta variant, predominantly by the Delta variant. So once it is a common sense, a high school student will understand that if the Delta variant has given the second wave, the 70-80% people have already been exposed to the Delta variant, and even those who have been exposed to the previous variant have got cross immunity against the Delta variant, particularly those who have exposed to the natural immunity. So this is the Delta variant. We should not be afraid. The European Western countries, it is causing havoc, because that havoc we have already experienced in the second wave. So the Delta variant, the question is whether it is more transmissible. Yes, it was more transmissible because the peak was 4 times higher in the second wave, which was due to Delta, and it was more widespread. So that's why we had more number of cases. But was it more lethal? The second question. It wasn't more lethal, because the case fatality rate, admitted cases, was lower than the first wave. So as the subsequent variants are not more lethal usually, that is the biological law, because the virus is also trying to adapt to the host, because it is symbiosis. And infection fatality rate, depending, like if 90 crores plus people were, and the death was around 3 lakh, the infection fatality rate in our country, because of a younger population, is coming to 0.1%. That if you encounter the coronavirus and if you are healthy, 0.1% is the infection fatality rate across all age groups and both genders. However, there are people who are elderly, who are comorbidity, they can be focused prevention, they can be given the vaccine, because that will also bring it down, the infection fatality rate further. But with such low 99.9% survival, the question comes when we have other competing diseases. We have got large number of communicable diseases. You must be reading in the newspapers that now people are dying, young children are dying of dengue, young children are dying of other viral fevers in UP and other places. So we have got much higher fatality rate than COVID, and we can use smart, because most of our population are already having the natural immunity. So host factors. Now first we had considered the environmental factors, agent factors, that is the transmissibility of the virus and lethality of the virus. Transmissibility definitely high, but in the advantage is it has infected large number of people who have acquired immunity. Now we consider, very importantly, today's topic is the host factors, what gives the advantage. Majority of Indians have encountered Delta variants, massive and widespread. So majority of Indians as on today have got antibodies. Every family must be having people like 2 out of 3. So family consists of 5 people, 4 people. So I am sure you must be, every household must have had 2 or 3 people. Each house has got the COVID infection, and once it is in the house, everybody gets infected. Others may also have got asymptomatic infection. And recent studies, as I said, 13 to 27 times stronger immunity, and almost 70 to 80% of a population health. And this can be considered as most robust population level immunity in the whole world. We have done. Maybe other countries like Bangladesh are more than high. They also may be having high immunity. And Delta variant was prevalent in India. So it may be causing havoc in West, but
So there is
having
some
recovered.
network issue, sir.
Yeah.
Some network issues. Now you speak, sir. Yeah, go ahead.
So majority of Indians have encountered the Delta variant. The host factors we are considering, and recent studies have shown that 13 to, as I have already said, more robust, and this can be considered as from the host, the Indian host as on today, the most population level immunity is very high, and Delta variant, we are already immune to it, and it may be causing havoc in West, but having recovered from it at population level, should we worry? That is a question. Then other host factors, which are always there with us, that is the lower age, lower percentage of overweight. We will see that all percentage of overweight, that is BMI, body mass index above 25, is about 20%, whereas the Western countries, Europe and USA, the body mass index is around 60% overweight. And cross immunity with other coronaviruses, more and more research is showing that it can give some protection. So this is something which I keep always showing. This I have tried from the developed countries in red, northern hemisphere, Asian countries in the green, and blue. I have tried to show the African countries. So I'll just see if I can get the pointer. So if you see the, I have tried to compare the median age overweight with the deaths per million. If you see, I'm not getting the pointer. Let us see if I can get the pointer around here.
Yes, sir. Your pointer is there now. It's moving. Cursor is moving. Bring it up.
Cursor, but it is white. White. Is it on? But the background, I think it is under the white background. I am not able to see. So
black one, sir. Small one. Here it is down now. Your cursor is down.
Okay. Is it available on the? Is it visible on the white screen?
Yes, yes,
No.
it is very much. Very much, sir.
Where it is?
Now it is down. Just bring it up.
Anyway, I try to, let us see with this other one where it is. Oh, it is going the other way.
Now you tell me, sir. Now I have put the cursor. Which one you want me to put?
You say just see the first column, the median age of USA, Sweden, almost 40. And Israel is younger age group, and Brazil is younger age group. But the overweight is around 60%. USA is the highest overweight, 68. And India is 18%, Japan is 27%, the second column. And similarly, Africa, most of the African countries are lean, except for Egypt and South Africa. If you see, South Africa, overweight is 54%. But the age profile is low, 20s mein. So
right.
Appreciate that. And you see the deaths per million correlates with the age and overweight. Deaths per million is 4 digits in the USA and UK. And Sweden never had a lockdown. And Sweden is lower than America and UK, which had lockdown. So you see the lockdown, this Bactiva is also. And Brazil, if you see, Brazil is very interesting. Brazil is having the overweight 56%, younger population 33, but 66%, 56%, and that's why it is having very high deaths per million. Whereas if you see India is 313, and India has got a younger age, and similarly Japan is very interesting. Again, it has got the highest age. 47 is the median age, higher than even the Western countries. But it has got a low 27 overweight compared to 68 in USA and 60 in other Western countries, and its mortality per million is 127. So Sri Lanka, again, I found very interesting. Sri Lanka was having very low mortality, much lower than India. But after the vaccination, the mortality, we will show the graphs. Somehow we don't know, that has to be explained. After vaccination rolled out, Sri Lanka cases also increase and deaths also increase. Bangladesh also, it is got very low, and the first dose and second dose, we are trying to show the vaccination. So if you see the higher vaccinated countries, like USA is first dose 60 and 50. I can't see the other screen. Can you see the full screen, Dr. Reddy?
Yes, yes. The other USA second dose is 49%, first dose is 62%.
And if you see there, 7-day average, this is the 7-day mortality. That is the first, second, third, fourth. Fourth is the, I have taken the current mortality experience. That is the, today is the 7th day, last 7 days average mortality. So last 7-day average mortality and vaccination status as on today. You understand? So this is again very important. I wanted to correlate whether the higher vaccination status is giving rise to less current mortality. This third column is deaths per million, the 18 months cumulative mortality. And the next column is the current mortality, recent 7 days. So I am trying to correlate it with the second dose coverage. If you see, USA has got almost 42. How much you said? 40.
4.2. First dose 62%, second dose 49%, sir.
Almost 50% USA, yeah, and we have got India is only 13-14% vaccinated. Second dose. India.
Yes.
And India mortality
first dose, 13%, second dose India.
Second dose. So much lower than USA, and India mortality is 0.24% per million, not percent, 0.24 per million compared to 4.2 for USA.
Yeah.
And you see Sweden is the only European country which is having the lowest mortality, and vaccination coverage almost same as USA and other European. It is having the 0.2. Why? Because it never had a lockdown. I don't know. I mean, these are data. There are a lot of questions coming. Sweden is the only European country. Last 7 days, it is having the lowest because it never had lockdown. Perhaps the population immunity has been preserved because of some immune stimulation. UK is having a highest vaccination rate. Completed kitna UK ka?
72% and 66%.
66%.
5% almost.
So 7 day is 2.1 per million and still much higher than India. Then you see the African countries. African countries, there are no vaccination. 1, 2, 3%. Yeah, 0.4%. And 7 day death is 0.24%. If you see the African, like everybody is saying, that Africa ke paas vaccine nahi hai, as if they will do a great service, but without vaccine, they are doing very well. If you see just African countries, the vaccine coverage is very low. And if you see South Africa, and Africa has got the highest vaccination coverage, 13%. But in Africa, African continent, they have the highest mortality. If you see Africa, if you see the racial things, they have got 3.3 deaths per million last 7 days, moving average. Last 7 days average is 3.3. And in Africa, they have got the 13% compared to other African countries, 0.41. I have taken some countries only because otherwise the slide would have cluttered, just to show that higher vaccination is not bringing down the 7 day mortality. If you see this, if you see the Asian countries and the vaccination rate, and the highest vaccination are in the, and if you see Israel is having the high mortality. USA is having the maximum mortality with 50% vaccination. How much is the vaccination, Dr. Reddy, in Israel? Second dose?
66.9% first dose, second dose 61.5%.
And still it is having the mortality of 2.9 per million last 7 days. And India is 0.24. Japan is 0.45. And Sri Lanka is, I am very surprised at Sri Lanka, why it is having very high mortality after the vaccination has rolled out. You see 6.85 and vaccination is 49%.
62% first dose, second dose 49%. In
and
Sri Lanka, mortality rate is very high after such vaccination.
The highest in last 7 days mortality is 6.85, highest in the world. I mean, among these countries, you can. So it is, I was very intrigued when I saw Sri Lanka, because I had been following the data throughout the 18 months and Sri Lanka was always much lower than India. Then when I suddenly saw this figure, I just looked at the trend. And the next year is very, very interesting. The Sri Lanka Paradox, I have named it. The Sri Lanka Paradox. If you see throughout the pandemic, Sri Lanka had almost very low rates. And vaccination started in February, March. First dose fully vaccinated was 0% in April. If you see partial vaccination was 4.2% in April. Is it clear?
Yes, sir. Very clear.
As they rolled out the vaccination, today it has got almost, what is the rate? PV is
62.2% and then 49%.
Full vaccination
PV is 62.2%.
Partially vaccinated 62% and
fully vaccinated 49%.
Almost 50% are fully vaccinated. In our country, only 13%. And they were at the baseline almost. And after the vaccination, isn't it paradox why it should increase? We expect that after vaccination, the transmission should come down. This is the new cases. And second slide is.
Sir, the Sri Lanka paradox, Dr. G has very clearly explained. I hope every citizen of this country and the world should witness this. Before vaccination, when pandemic was at its worst, see the mortality rate in Sri Lanka.
This is the
Once
cases.
the vaccination
Reddy,
started.
Dr. Reddy, this is the cases. Next slide, I will show the mortality. This is the cases because we are interested.
Yeah, yeah. Yes, sir. Yes, sir.
Because
Yes, sir. Let me.
there are two things
Yes,
the
sir. Yes, sir.
vaccination.
Just to the common man, let me explain it to the common man, sir. Once, if you just give me a
Yeah.
minute, because it's such
Yeah.
an essential slide. Dr. G has taken full pain to present the world in front of you. The earlier slide was very clear: age group, median age group, weight, and what is the first vaccination rate, second vaccination rate, and the mortality rate last 7 days and before. Very clearly shown. Now you have to understand why, in spite of fully vaccinated countries, I mean to say better than India, why the infections have gone up, why the mortality rate has gone up. And here in Sri Lanka, the paradox is, when before starting the vaccination, you see the infection rate here. After starting the vaccination, partially vaccinated 62%, that means those who had only one dose, fully vaccinated 49%. Now you see the infection rates. Why did it go up? Is it because of vaccination? Before it was, is it not because of natural immunity they could sustain and overcome? This is a big exposure on this show. Yes, sir.
You see, this is in the context. There was an article last some 6-7 months also in the British Medical Journal. Also, there was a comment, and subsequently, the eminent virologists have expressed concern. Like if you are rolling out mass vaccination haphazardly, it can lead to mutant strains. So probably this can be investigated. This is just a hypothesis because this data is at a population level. We cannot be very sure, but this concern has to be investigated. I am not saying you have given, but like we give incomplete antibiotic, we say don't give indiscriminate antibiotic, it gives antibiotic resistance. Similarly, vaccine resistant strains are more transmissible. So this is one here, and now the second slide is the Sri Lanka mortality after. So this is, if you see again, mortality is also showing an increasing trend after the vaccination started. If you see, the mortality is almost very low near the baseline. Vaccination initiation started February, March, then the people started getting vaccine. In May, it was first dose was full vaccination was 0%, partial was 4.2, and by the time they completed the vaccination, the mortality has also increased. If you see, it is very evident. I mean, this is staring you in the face.
It is now it is on your screen. I hope every citizen of this world will understand. Before vaccination initiation, what was the mortality rate? After partial vaccination and full vaccination, why is this mortality rate in Sri Lanka has gone up? This has to be debatable. WHO, right from World Health Organization and Indian Council of Medical Research, Drug Control Government of India, right from Prime Minister's office to Chief Minister's office, Cabinet Secretary to Health Secretary and Chief Secretaries, you have to take all this into cognizance. Why the infections have been increasing after partial or full vaccination in the people of the respective countries? Why the mortality rate has been on the increase after partial or full vaccination in the countries? This is a big exposure. Figures are there on your screen. Yes, sir.
Yeah, and another thing is like the vaccines have they say we are this emergency use authorization. It is in trial mode, and in trial mode there should be a control group. What the countries are doing wrong, if they are doing a trial, is they should keep some villages or some parts of the country as control. So here, once you are rolling out mass vaccination, you will not know whether the subsequently that it will come down, the peak will come down, the cases peak will come down, the vaccination peak, this death peak will come down, because what happens, even those natural immunity will also bring it down. Even if there are more cases, people who died vulnerable, unfortunately they will die, but the survivors will have immunity. So then it will be very difficult to know whether you give third booster, fourth booster, fifth booster. We don't know whether those boosters are bringing down the death rate and case rate, or it is due to the natural pandemics after the exhausted, after all the susceptibles are infected, they develop, either some die unfortunately, and those who survive develop immunity from natural infection. So we will just make the year very hazy. Nobody will know when it comes down. It would be very easy but unscientific to claim that vaccine has brought down, because we don't know. It might be vaccine has brought down, or it may be natural immunity also can bring down. So this is something which, if it had been a trial mode, they should have kept some villages or some part of the population with the vaccine, and others could have been kept as control if they are doing the trial. So otherwise, this is not a proper trial. You have a control group. You cannot take historical data, because historically natural infection also gives immunity. Now I took some other countries also, Malaysia. I said, let us see other Southeast. Again, Malaysia, see, vaccine initiation started when trend was going down. That was in February, March. And then they gave the vaccine, and again the cases have increased after the vaccination. This is Malaysia.
Wonderful, sir. Wonderful. Country after country, after partial vaccination, full vaccination, you see how the infection increased, how the mortality rate has increased. The figures are on your screen. Before vaccination initiation, what is the mortality rate? What is the mortality rate after vaccination? It is on your screen.
These
Why?
are the cases in
Malaysia. Because of natural immunity then, and is it because of acquired immunity through vaccines? Why this mortality rate going up, infection rate going up? It should have come down. That is what the paradox is all about. Yes, sir, please.
This is the death rates in Malaysia. Again, the death rate is also increasing. Before vaccination, death was almost minimal, because cases are more, because cases are very most asymptomatic. Just by RT-PCR they are detected, but hardly any deaths in Malaysia before the vaccine. After the vaccine, PV and full vaccination, 6.3% say gradually as you increase the vaccination, the fatality increased. So this is a matter of concern, which has to be investigated. I don't know what is happening. It may be many factors that
it has to be investigated.
Unusual, something unusual.
This is something unusual. When you take a vaccine, the acquired immunity, if the so-called acquired immunity, if you gain, that should protect you from the disease. Then why infection, and why mortality, why fatality rate, why are people dying? Why are people getting infected in spite of partial and full vaccination? This is on your screen, right on your screen, all the evidences. Yes, sir.
I would say this requires investigation, Dr. Reddy.
Yes, this requires investigation. Why before vaccination? Why before vaccination infection was late, very less? Is it because people are asymptomatic? Because their association with those infected and all allowed them to acquire natural immunity? And why?
No, this is mortality. Vietnam is again the same picture. Almost cases before vaccination is baseline. No cases. After vaccination, you see, I am really confused. I have no explanation.
When an epidemiologist, community medicine specialist like Dr. Banerjee is confused, no explanation, what should a common man do? He should question the authorities of the day, question the government. What is happening? Where is science? Where is logic? Yes, sir.
This is the death after the, of course, Vietnam vaccination is less, but something happens. I think whenever they start vaccination, either it is giving some mutation. We don't know what is happening. I mean, I am not a virologist. We require a combined investigation, whether there is a mutation is promoted by vaccination or we don't know. These are the deaths in Vietnam. Because before the vaccination,
it is the same in Kerala also. Escape in Pathanamthitta, 7,000 cases in spite of Covishield and Covaxin. That is why now it is coming out true in the world. Why doesn't government, again, in the name of Prime Minister's birthday celebrations, they say we go for mass vaccination? What is this hysteria? Why then no liability and compensation? Is it health not an individual's perspective? Can the Indian citizen decide what type of prevention measures he should adopt? What is this happening? Yes, sir.
This is Indonesia. Indonesia, they had a first wave vaccine. Actually, many people, virologists, epidemiologists say that at the height of a pandemic, one should not start vaccination. because at the height of the pandemic, the transmission is intense with virus. If you put vaccine pressure, there is chances of mutant strains. So you see the second wave after vaccination, the second wave in Indonesia was higher than the first wave. So they started vaccination at the middle of the pandemic because they are not planning, they are giving haphazard whenever there is there. So this is again partial and fully vaccinated. Of course, these vaccinations are not full, but still there is some change in equilibrium. Something is happening which I am beyond me to comprehend. Now, these are the new cases in Indonesia. Let us see the deaths. You see, deaths are also, that is a matter of major concern. I am more concerned with deaths.
You're more concerned with deaths. Why deaths have been happening after partial vaccination and full vaccination? 27.8% and 15.9% in Indonesia. Country after country, we are just giving you all the figures. Now, this is there on the screen. This is how you need to do a show when it concerns health. Not only health, everything else. Because health matters. We are trying to project everything on your screen. Please, sir.
This data is from the Worldometer. It is in the public domain. And I would like people to interpret it themselves. I am, because as I said, it is beyond me. I have not seen thus paradoxical data in my life. So I will not comment on it, what's happening, but it is something which requires really. This is the United Kingdom. And now I am just showing some countries which are in the northern hemisphere. And it is well known that respiratory diseases follow a seasonal pattern there. When their winter comes, October, November, December, cases go up. Summer comes, cases go down. So it was happening earlier also. You see, September, October, November, cases went up before vaccine and cases came down. You see, and now the summer has come, again cases are going up with the, but when the vaccination started, cases started going up in June, July only. In June, July, UK, it went up. And of course, now we have to see now what happens. Now the coverage is, I think, partial vaccination is 72% and 60%, I think. What is the full vaccination in United Kingdom? It is one of the earliest vaccination.
66.3%, Dr. G. 66.3%. Partial vaccination, 72.7%. Combined, you can say it is 65 to 68%.
68, but still it is having the cases are occurring, breakthrough cases. So it has not interrupted transmission, and it would be interesting to see now their respiratory season is coming, because winter is coming. They are, let us see whether vaccine really cushions it compared to the previous year. So it is very interesting, and their population is just 6 crores. If they are not able to control it, and this is the death rate. Of course, death rate is again, it has come down. Vaccination, definitely we can say it may be preventing some deaths, but this is again, these are not very easy to interpret, because the vulnerable people, they die in the first wave only. Subsequent wave, they are less vulnerable people, but we have to wait for the winter to come. So this is, and we cannot compare, as we saw in the Asian countries, after vaccination there is a peak. Here it is following the normal seasonal pattern, which we have to wait and see when the winter comes there. This is Singapore. Singapore is again very interesting. It had cases, it had the first wave, and subsequently Singapore was again a very small country. It could vaccinate, and new cases after the vaccination started. I think it is 52%, Dr. Reddy, full vaccination.
78.6%, sir.
It is one of the most vaccinated countries, and the cases are rising again in Singapore. You see, Singapore is a very small country, and if they cannot control with vaccination, can we 130 crore, can we control it? So chaotic. And if we are not getting cases, we should thank nature, because of our population density, the virus has run through us and it has given us natural immunity. When a Singapore, hardly, I think 1 crore or less than 1 crore population is not able to, 78% it is. So, I mean, we have to see whether we are wasting our resources. We can save so much money. I mean, so other health problems are raising their head nowadays. These are the death rate also. Singapore death also is increasing. I mean, it's a small country. These are the United States. Another interesting, about 50% of the people are vaccinated. And if you see, like the northern hemisphere, it is following a seasonal pattern. December it peaks, Like all respiratory, it is something like a wave, tidal waves which come and human beings cannot stop it. So pandemics are also just like tidal waves, first wave, second wave, and it is a nature's phenomena and natural immunity comes. Vaccine, we are tried for the first time to do lockdown and vaccine against the big natural forces, and I just want to show how much impact we have made. We have made very minimal, in fact, with the amount of resources exhausted in it, amount of money, 36,000 crores India is spending on vaccination, just 75 crore doses, 36,000 crores. So, and it is making a minimally, whatever is happening due to the naturally acquired, the bulk of it due to the naturally acquired immunity. And of course, vaccine also provides, if you want to do it a faster herd immunity, you should vaccinate people who are not have the infection or who do not have antibodies. So we can, or who are the elderly, who have comorbidity, instead of mass vaccination to healthy people. We are wasting resources. And these are the daily deaths. Again, daily deaths, vaccination is there. Again, the deaths are increasing. If you see, in spite of the 54% partial vaccination and 45%, 64%, the deaths are again increasing in United States because it's a big country, the dynamics of how much impact vaccination is making is very, I mean, we require more in depth rather than rolling out to everyone. Now, this is the Indian case. India, when we started the vaccination, the cases are already at the peak we started, and when we had already cases when we have in month of June, the partial vaccination was a 17% in month of June. Because this month of June is important because this is the time when sero survey was done. And at the month of June, the sero survey result showed about 67% seropositivity. That means the bulk of the Indians have already sort of vaccinated. Already we have had a one round of vaccination. Unfortunately, many people died. That is very unfortunate. But once we have, and that was the Delta variant. So after that, if we are getting any trend is going down, it is the tempo of the falling trend, which is a natural phenomena. And it would be very difficult if we do mass vaccination. It will be very difficult to know whether it would have come down otherwise or it is effective. As I said, you are confusing the picture. You are confusing the picture. And the natural immunity, another thing is the natural immunity is there in the body for 15 days. So if this is a virus, the vaccine is only part of the year, whereas the whole virus is the body immune system in a natural infection, the whole virus. So any 1% or 2% changes in mutation, 98%, if you have got natural infection, 98% virus remains same with the body's immune system can recognize. Vaccine escape is more likely compared to escape after natural infection. So these are the deaths. Again, deaths have come down. Before the vaccination was fully rolled out or it just started, the already downward trend had started. Partial vaccination and in month of June, the deaths have come down. So this is the Indian data. So this countrywide comparison, to sum up, this is to sum up, age and more importantly, overweight is related to higher mortality, and now which has been established now from other studies. High vaccination coverage is not associated with lower 7-day trend in cases and deaths across countries. We tried to compare the vaccination coverage and last 7 days mortality as on the today, last week. So as on today, and we can keep on monitoring that. Probably the combined effects of host factors, age, obesity, and cross-infection with other coronaviruses, most importantly, recovery from natural infection, more protective than mass vaccination. So mass vaccination is maybe making an impact, but it is much less compared to the other major factors, which we can call the elephants in the room, which nobody is recognizing. Even the mainstream medical consensus is saying. Even yesterday, I was seeing a statement from, I think, Dr. Paul. He said that the third wave will be less because 62% Indians are vaccinated. He had never mentioned that 67% have already got natural infection. So this is overlooking the stronger immunity and just saying that we have launched out the year. So we will, this is not very scientific way of looking at things. And as I said, had we taken some districts for ongoing trial, emergency use is when there is emergency. When the trends are falling so rapidly down and it has fallen down, there is no longer emergency. So we could do a proper study by keeping some year and seeing the impact. Those vaccinated, mass vaccination or whatever, or best would have been to focus the vaccination to the vulnerable groups. It would have saved resources. And another problem is long-term effect. We will not know of the vaccines, particularly when you are giving to younger age group. Points for debate. So as I said, cannot give opinion because I myself had confused with the data. So I would like, these are the points. As countries with much higher vaccine coverage have higher trends, this requires to be debated why. Then if you see the countries like Pakistan, Bangladesh, India, a much lower trend in spite of, in fact, Bangladesh was still low vaccination coverage and the death rate and case rates are much lower than India also. Similarly, Pakistan. Based on the data, it would be worthwhile to conserve resources and instead of mass vaccination, focus only on the vulnerable. Vaccination is a very important tool and we should use it very judiciously. And particularly, there are concerns from some scientists that mass vaccination, just like mass antibiotic use, we keep telling that antibiotic resistance or antibiotic, but why we don't think they can be vaccine resistance also? Mutant strains can come also. Many countries, particularly the Southeast Asia countries, I mean, this showed spike in cases and deaths after launch. So that requires further study. Some scientists had concerns about mutant strains due to mass vaccination during an ongoing pandemic, requires more research. So these are some of the references which I have to support whatever statement I have made about natural immunity, about sero survey. And as I said, most of the data I have taken on trend in the public domain, it is in worldometer. So not what I say is just I have presented the data. I don't want to give any opinion. We don't know who is right, who is wrong, but the data is throwing up interesting questions. So science is about questioning, science is about debate. Science is not about diktat. So this is what I have to now. I conclude here. You can take any points.
Yeah, you just come out of the presenter mode, or else I'll just try to wait. Yes, sir, you're out of the presenter mode.
Yeah.
Wonderful presentation, Dr. Banerjee, because as I've been regularly putting it across, this show runs purely on the merit of constitution, rule of law, and evidences. What more you want? So clearly, so evidently explained, country after country, including India, about vaccinations and about the elephants in the room. They are still there, the elephants are there in the room. You are letting loose lockdown, mass vaccination, masking, and whatnot. And you have seen the infection rate and the mortality rate, country after country, including India. We are not biased. Whatever is happening in India also, why the death rate has come down? Is it because of mass vaccination or is it because of natural immunity which people have gained? The sero survey, which Dr. Paul quotes, is it not because of natural immunity, Dr. Paul? What the serological survey of June 2021 says by ICMR, is it not true? So these are all the questions. That is why people should understand that it is your natural immunity which will really protect you. And those who want to go for a vaccine, no taboos. But the science is logic. The science should be questioned, and the science behaves with evidences, not dictates. How can you impose science? What will you lastly conclude, Dr. Banerjee?
Thank you.
How do you conclude?
I conclude that throughout the pandemic, there was one editorial in British Medical Journal that in this pandemic, science has been suppressed. So that still continues. And I heard leading epidemiologist of Harvard University, Dr. Martin Kulldorff, he says in this pandemic, the science has been thrown out of the window and the common man has been thrown under the wheels of the bus. So this has happened. Science has been thrown out of the window and the poor man has suffered from the restrictive measures, and it is still suffering. If you make mandates, they will lose their livelihood, they may not be able, and we don't know the side effects and adverse effects. As I said earlier also, in a mass vaccination, when there is such chaos, anarchy, and it is in a hurried mode, it is not only the vaccine, it is the logistics of it. You have to monitor the side effects and even sometimes deaths. And if somebody, a healthy person who would never have died of COVID, but God forbid dies of a vaccine, it is a major, amounts to manslaughter. I would say it is negligence and it amounts to manslaughter. So one has to be very careful. Where is the emergency now? I am just not able to see the emergency. If a thing is authorized in an emergency use authorization, one has to be very careful. And one should use it only when the risk benefit is there, particularly elderly people and morbidity, because that person is more likely, 10 times more mortality. But in a young person, healthy person, one has to wait and watch. So that's what I can say. We have to have all the answers before we proceed. I'm not against vaccine. I myself children got vaccinated for the common childhood diseases. I always advocate. Even COVID vaccine, I advocate to those who are elderly, those who have got mobility. But children vaccination or young people, we don't know so many things. We particularly long-term effect, because elderly person, there is no long-term effect. He has few years of life remaining. But a child, suppose the vaccine is 2 years down the line, 3 years down the line, there are some, you see, in the UK, there have been myocarditis. There have been heart problems. So young child, if heart is a long-term organ, you require a good, healthy heart for a long life. So if you have got some, we don't know, these are vital organs. So this is, I mean, there's so many unknowns in this. Once they are unknowns, we have to be very, very cautious. That's all.
With unknowns, we should be very, very cautious. Why should you copy the others? Every citizen, the health matters. The health behaves differently. That is what we say constitution. And also the country after country, you have seen how after full vaccination or partial vaccination, infection rates are increasing, mortality rates are increasing. One should not question this. Now India getting into ambitious plan that we will get everyone vaccinated. And you have seen how dare that man, Covishield, he says he's going for third dose. What is that nonsense? He wants all his employees. Then the question arises, VIPs and all those, are they be really given the candidate vaccine? Because this vaccine, through this show, I'm questioning ICMR and DCGI, all the governments, union government, state government. Are the vaccines not under trial? If under trial, don't you think there should be candidate vaccine as well as what you call the other mode? What is that? Placebo. So all those control groups. So all those VVIPs, the chairman of the manufacturers, are they taking control? Are they in our control groups? That means placebo. Rest of the population being made to undergo trial because there is no liability and compensation angle. You are bringing an epidemic act to suppress people's freedom, expression. That really shows science is not that. Science allows you to question. And that too, when it concerns human health, health really matters. It is individual perspective. Every citizen in India is a constitutional authority himself. Through the taxes paid by them, these governments run, and they should be in the welfare, and even if the development should be transparent and accountable. How are you trying to influence people through legislation when it is a health issue? Don't you think every citizen, people should be informed whether they should go for this vaccine or not, whether they should go for this treatment or not? That is why I've been questioning, what is Indian medicine? Where is the data? Where is the serological data? ICMR says 67%. By this time, it should have been 70 to 80% natural immunity. Means those who are already infected, and keep this in your mind, you should question every authority, not just those who are infected. trace who were associated with them, who were in companionship with them, trace them, test them, and quarantine them. Is it not true? Were they hospitalized? I'm questioning not only ICMR, DCGI, right from Prime Minister to Chief Minister, Cabinet Secretary to Chief Secretary, but World Health Organization, all those who matter. Didn't such population acquire natural immunity? Is it not that which is showing up? To suppress that, are you not indulging in this mass vaccination to create fear psychosis, to turn a health issue into a law and order issue, thereby a political issue, thereby a pure advantage, commercial advantage to few some who are trying to dictate the world and the polity at the cost of suppressing human freedom? What is happening right from Australia, US, everywhere? Is this the way we should tackle pandemic? Now, India, wake up. They have shown you what Ayurveda, Anandaya's Corona medicine can do. High Court, Andhra Pradesh High Court cleared it. Ayush cleared it. Why not? It is being still used under emergency use authorization for prevention as well as cure. Likewise, Khadarvili, millets therapy, naturotherapy, nice. You name it, there are so many other things. Why they are not being accorded the same? 36,000 crores and don't know how many thousands of crores are being spent. Is it not public money? When people are recovering on their own, your own statement, 99.99% recover on their own. Your own ringtone, in spite of vaccines, maintain social distance, mask yourself. That means those are not working. You yourself have accepted. Patanam Titta in Kerala, 7,000 cases. Immunoescape, like that, everywhere you are finding them. When such is the case, why this precious money, public money, taxpayers' money, is being used for something which doesn't approve by science? Don't you think that huge thousands of crores could be utilized for those who lost their income because of this pandemic, right from migrants to everyone? Children's education, that is compromised, showing pandemic health as a big issue. And so many other disorders, right? Seasonal dengue to diarrheas, other chronic diseases. Now I'm challenging through this ICMR, DCGI, right from Prime Minister to Chief Minister office. How many people in India die? Is it not 27,000 per day? How many of them Corona is accounting? Where is the autopsy report? Where are the case sheets? Why, right from ivermectin, you went on changing the drugs for treatment. Now the mass vaccination. You yourself say mutants, delta variants. What about those vaccines which have been manufactured? Do they contain any part of this new variant? Then is it not the natural immunity? The elephants in the room, are they not contributing to the safety of human beings to escape this infection and come out strong? Kindly understand, at least now people should start questioning the government, because it's your health. And again, let me make it very clear, Dr. TSPR channel or shows, we are not against the will of the people who want to go for vaccination or that treatment, but question them why it is not being got under liability and compensation angle. Why hospital ask you to write a consent form before you get into ICU or surgery, for that matter any? Are they sure? If not, why should you? And don't forget, it is our own money. No party gets the money from their pocket. It is our taxpayers' money. So you need to question that too when it matters health. So individual liberty is at stake. Personal liberty is at stake. The life is at stake. Right to life is at stake. Come on, wake up. Start questioning. And we will be coming out with many shows in series also, only in larger public interest, mind you. Nothing against anyone. In larger public interest, through science, we question. So this is one of the shows again, to question through science, to understand and to get the answers. The people who matter, you have to answer. Sir, thank you. Take care.
Thank you, Dr. Thank you.
See
Thank
you,
you.
see you, see you with another series shortly.
Thank you.
This show will be retelecasted tomorrow on Citizens Dr. TSPR channel. Support Dr. TSPR channel, Citizens Dr. TSPR channel, Environment People Dr. TSPR channel. They all are working in larger public interest with Constitution, rule of law, invoking Evidential Act in larger public interest. Understand? Kindly support. So do watch it tomorrow on retelecast, and it may be telecasted on Dr. TSPR channel too, because it is very, very fundamental with such huge data, and we have shown the source of the data also. That is what I appreciate my guests who come on to this show, because those are all evidences. We speak with evidences, scientific evidences, logical evidences. So take care, stay healthy. Thank you once again, Dr. Banerjee. For those people in India, Sukha Nidra Shubha Ratri. For the people across the globe, good morning, good afternoon, good evening. Thank you, sir. Take care. Bye.
Thank you, Dr. Reddy. Thank you.
Bye.
Pleasure.